Hi everyone. We're going to delve into one of the most influential methodologies in qualitative research, grounded theory. As we begin, let's focus on the first slide, which serves as our guide to understanding the core concept, its inception, and the advantages it brings to research. Grounded theory, at its essence, is an inductive research methodology. That means instead of starting with a hypothesis, researchers collect and analyze data, allowing theories to emerge directly from the data itself. This approach enables the theory to be deeply rooted or grounded in the actual data. The origins of grounded theory trace back to the work of two sociologists, Barney Glaser and Anselm Strauss, in the 1960s. Frustrated with the limitations of traditional research that often overlook the perspective of those being studied, they developed grounded theory as a way to generate rich, nuanced theories that were intimately connected to real-world observations. Grounded theory has numerous benefits that make it a valuable research methodology. For starters, it allows researchers to produce theories that are highly relevant and empirically based. This is particularly valuable when exploring complex, uncharted, or dynamic areas of study. Additionally, grounded theory is flexible and iterative, fostering a deeper engagement with the subject matter as the researcher moves back and forth between data collection and analysis. This continual interplay often yields fresh insights and creates a rich fabric of understanding that is both rigorous and verifiable. As we proceed with the presentation, we'll explore how grounded theory not only aids in theory construction, but also enhances the authenticity and depth of qualitative research. Let's take a closer look at the key components that make up the grounded theory methodology. Is grounded theory considered qualitative, quantitative, or both? Grounded theory research is considered a qualitative research methodology. So the primary reason behind this categorization lies in its fundamental approach to data collection, analysis, and theory generation. Grounded theory really aims to derive theories from data that are systematically gathered and analyzed. So let's take a look at some of the key aspects that categorize grounded theory as a qualitative method. So data collection. Grounded theory often involves collecting rich descriptive data through various qualitative methods such as interviews, observations, document analysis. And this data is not really numerical or quantifiable in the initial stages. Next, we have the inductive nature of grounded theory. It uses an inductive process where patterns, themes, and concepts are really identified from the data itself rather than being driven by a pre-existing hypothesis. Next, coding procedures. So through open axial and selective coding, researchers categorize and interpret the data, developing concepts, properties, and dimensions that facilitate the emergence of grounded theory. Next, we have constant comparative method. This is a core component of grounded theory where researchers continually compare incidents in the data to find similarities and differences that aid in the development of conceptual categories. Then we have the theoretical sensitivity of grounded theory. This is where researchers bring an awareness of the subtleties within the data, which helps in the generation of a deep, nuanced understanding of the research context. Then we have the construction of the theory. So the goal is to construct a theory that's grounded in the data itself, rather than verifying an existing theory, which is a more quantitative approach. And then lastly, it's rich description. So the resulting theories are often presented with rich text-based descriptions that provide a deep understanding of the context and participants' perspectives. As we transition to the next slide, we'll examine the core components and the steps involved in grounded theory research, which are crucial to the integrity and efficacy of the method. Grounded theory is built on several key components that guide its application. These include theoretical sampling, data coding, constant comparison, memo writing, and theoretical saturation. Together, these elements form the backbone of the grounded theory approach. The first component, theoretical sampling, is an iterative process where the researcher seeks out participants or incidents to help elaborate and refine emerging categories. Rather than defining a sample size up front, the researcher allows the needs of the developing theory to guide this decision. Next, we have data coding, which is divided into open, axial, and selective coding. Open coding involves breaking down, comparing, and categorizing the data. Axial coding connects the categories developed during open coding, showing relationships. And finally, selective coding integrates and refines the theory, focusing on the central phenomenon of the study. The constant comparison method is another vital ingredient. It involves continuously comparing incidents, concepts, and categories to one another to establish analytic distinctions and refine theoretical constructs. This iterative process ensures that the emerging theory remains grounded in the data. Memo writing is an ongoing documentation process in which researchers reflect on the data, the coding process, and the emerging theory. These memos serve as a crucial audit trail that captures the evolution of thought throughout the study. And then lastly, the concept of theoretical saturation plays a crucial role. It is reached when additional data no longer contribute new insights to the theory, indicating that the categories are well developed and the theory is robust. Understanding these components is imperative as they collectively inform the distinct steps of grounded theory methodology. Identifying the research question without preconceived theories, collecting data through interviews, observations, or documents, engaging in the successive phases of coding, open, axial, and selective, writing analytic memos throughout the research process, applying theoretical sampling to focus data collection on emerging categories, ensuring constant comparison to refine categories and identify their relationships, and achieving theoretical saturation to finalize the grounded theory. Together, these steps provide a structured yet flexible framework for building a substantive and sophisticated theory directly from the data, which is the hallmark of grounded theory. With an understanding of the key components and steps, let's move forward, and Matt will share an example of a study that used grounded theory.
Next, we'll be taking a look at grounded theory at play with an example study. The example study that we're going to utilize is the delivery of primary health care in remote communities, a grounded theory study of the perspective of nurses. The goal of this study was to use grounded theory and its data to derive a theory about primary healthcare delivery in rural communities throughout Australia. The result that came about was there are significant compromises needed to be made in order to provide care in rural Australia. And because of those compromises, an increase in education, resources, and nursing support would increase the quality of care for these patients. Next, we're going to take a look at methods and results. For this study, a sample size of 24 was used. Of that 24, 13 were nurse practitioners, 7 were remote area nurses, and 4 were nursing academics. The average age across the participants was 49, and the average nurse experience across the participants was 24. Phone interviews were conducted for each participant, ranging from 45 minutes to 1 hour. In those phone interviews, open-ended questions were asked to collect qualitative data. After original data collection, an expert panel of 5 remote nurses was used to corroborate the findings. One key issue arose from the results, and that was the inability to provide care. This was explored over 4 key themes: the level of clinical knowledge and skill, the availability of resources, the understanding of the social world, and personal support. The inability to provide care due to clinical skill or knowledge came about of the broadness of scope in practice. This could range from immunizations to emergency roadsides management of trauma, chronic disease, common illness, and injury across the lifespan. The availability of resources such as blood pressure cuffs and EKGs made primary health care in rural areas very difficult. Nurses also reported a cultural barrier as an inability to provide care, as it was difficult to connect with their patients and customs of rural areas. Lastly, there was a lack of support between managers located in regional hubs and nurses locating in field works, making it hard for nurses to get the support they needed. Next, we'll look at the credibility and purpose and impact of this study. Credibility starts with the primary author working on this paper as part of their PhD. In addition, the primary author had 23 years in rural healthcare as a nurse. The impact of this paper is threefold. First, it states that primary care is often the only healthcare provided in rural areas, making it the first line, second line, and third line. Also, in rural areas, the scope of care is vastly increased as the nurse practitioner, needs to know a wide variety of cares and interventions to help the population at hand. Lastly, there's also a need for increased awareness and funding in rural healthcare to provide the correct patient care for these rural areas. Challenges and limitations. Since grounded theory starts with data, there needs to be a large sample size for grounded theory to be effective. Since there is a large sample size, it could be hard to obtain participants of a certain subject matter in order to gain the magnitude of data to derive theory. Since theory is derived from raw data itself, extensive knowledge of the subject matter is helpful to identify themes and ultimately derive the theory. Lastly, theory derivement is heavily reliant on the author's ability to make connections, inferences, and comparisons with the raw data itself.